Hello and welcome to the first episode of our video series. Today we will be exploring the COVID-19 pandemic on our hands and simplifying it in order to be as reachable as possible. The coronavirus pandemic is a disease that has impacted the world today. It is caused by SARS-CoV-2. The virus was initially detected in Wuhan, China in late 2019. Scientists believe that it originated from bats. It is a highly contagious disease and impacts the lungs and respiratory canal of the victim. Most infected people will experience mild to moderate respiratory illness. It spreads primarily through the droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important to practice respiratory etiquette. For example, cough into a flexed elbow. The most common symptoms of COVID-19 are fever, dry cough, and fatigue. Other symptoms that are less common and may affect some patients include loss of taste or smell, red eyes, sore throat, muscle or joint pain, nausea or vomiting, and diarrhea. Symptoms of severe COVID-19 disease include shortness of breath, loss of appetite, chest pain, and high temperature. People of all ages who experience these symptoms should seek medical care immediately. If possible, call your healthcare provider, hotline, or health facility first so you can be directed to the right clinic. COVID-19 testing involves analyzing samples to assess the presence of SARS-CoV-2. It's very important as you can only get the right treatment or self-isolate if you know the result. It's used to assess disease prevalence, which aids the estimation of the infection fatality rate. There are three main types of tests. The molecular test, commonly known as the RT-PCR test, is a method of testing that is used to directly detect the presence of the virus in the sample. The test detects the virus's RNA. A nasal or throat swab sample is taken. A negative test doesn't necessarily mean that you cannot be infected. You might have taken the test in early days. These tests are the most accurate. Results are given within 2 to 3 days, and the cost of the antibody test kit is somewhere between Rs 2,000 to Rs 3,000. A COVID-19 antigen test helps identify the antigens related to the COVID-19 virus. An antigen refers to any foreign matter or viral proteins in the body that triggers an immune response. Antigen tests have a higher chance of missing an active infection. Sample is taken through a nasal or throat swab. Since it is a rapid test, results are delivered in 1 hour or less. If you get a negative result, it might need to be confirmed using a molecular test. Cost of the COVID-19 antigen test kit is somewhere between Rs 400 to Rs 500. COVID-19 antibody tests or serology blood tests are screening tests for COVID-19 antibodies in your blood. It tells if you were previously infected with the virus. It is tested by drawing your blood sample. Results are delivered within 1 to 3 days. The cost of COVID-19 antibody test kit is somewhere between Rs 500 to Rs 600. The precautions one can take for COVID-19 are to wear 2 masks, constantly monitor your oxygen levels, stay home, stay safe. Avoid visiting public places, especially clinics and hospitals, unless urgent. Practice social distancing and isolate yourself if any symptoms are seen. The best way to prevent transmission is to be well informed about the COVID-19 virus and how it spreads. Protect yourself and others by washing your hands and not touching your face. Meanwhile, stay home and stay safe.